This meeting is now being recorded.
Hello, my name is Dr. Sandra Cleveland, and our presentation here today is looking at using PICO to organize the evidence. According to Sackett and colleagues in 2000, there are three common components that an evidence-based researcher must integrate. The person must integrate best research evidence, clinical expertise, and patient values. And when we look at the definition of evidence-based practice on the screen, the definition looks at the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. By integrating individual clinical expertise with the best available external clinical evidence from systemic research. So looking at Sackett's definition here on the screen from 96, and then again in 2000, the three common components, looking at the research evidence, the clinical expertise, and patient values are key components in determining this. Evidence-based practice is aimed at hardwiring current knowledge into common care decisions to improve care processes and patient outcomes. Evidence-based practice holds great promise for producing the intended health outcome. Following the alarming report that major deficits in healthcare caused significant preventable harm, and this is when the Institute of Medicine in 2000 report, a blueprint for healthcare redesign was advanced in the first qualitative report the IOM did in 2001. A key recommendation from the nation's experts was to employ evidence-based practice. The chasm between what we know to be effective healthcare and what was practiced was to be crossed by using evidence to inform best practice. Built into the idea of evidence-based practice is the definition of quality healthcare. This definition states that it is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. The phrases in this definition bring into focus three aspects of quality: services, i.e. interventions, targeted health outcomes, and consistency with current knowledge or the research evidence. So one of the things that you want to take away with this is if you know how to ask the question, you can find the appropriate answer. So one of the tasks with using PICO is learning how to ask the right question. One of the other things you want to take into account is you want to learn how to ask the relevant PICO questions so that you're also taking into account your patient wishes. Remember, that is one of the components of evidence-based. This next slide shows the different types of questions that you can organize a PICO question into. And we're going to talk about this a little bit more later, but I wanted to provide some definitions now, or some just ideas with it now. So under the type of question, we have therapy, diagnosis, prognosis, etiology, prevention, and quality improvement. Within this chart, you'll note that there also identify the types of studies or the research methodology that can be used based on the type of question, as well as some of the ways you can filter to get to some of these type of questions based on Medline investigation. So looking back at the type of questions, therapy, basically therapy is kind of considered where you're the controlled, the randomized controlled trial. You really don't want to accept less than this particular type of study. Diagnosis is finding out when we study it more tomorrow. When you get a diagnostic test, you just don't randomly assign people to get one type of test and then another person just gets the other. You want the best way to test the accuracy of a test. Or if a person is to get tested, you're going to use the gold standard or highly accurate test. So that's what we're trying to investigate. And we're trying to determine how the new developed diagnosis tool compares to the gold standard. Prognosis and cause. It's unethical to assign people to some form of harm. But if we look at a group of people who are similar, some who have been exposed to something and some who have not. For instance, looking how fluoride in the water is good or bad for individuals and how it may affect the bones and cavities. Others say causes bone problems and other things later in life. So we want to look at similar groups of people who happen to have been exposed to fluoride, for instance, and see if there are similar illnesses or benefits that can be seen among these groups. So this is not something you'd randomly assign, especially if you're thinking that fluoride could potentially harm people. And the type of question for prevention is very similar to treatment. You have similar types of studies, so you might look to see, does ginkgo biloba, for instance, help memory? Does green tea help with preventing cancer? These are also cohort type studies. Again, similar to what we just discussed, groups of people who may have been exposed to the same thing, but we did not purposely expose them to it per se. But we can kind of start suggesting cause and effect with this type of study. So the point of this particular slide is that there are different types of questions that you can ask, and are best answered by different types of study. And one of the things you want to do is use that information when searching. According to Sackett and colleagues in 2000, there are 7 steps to evidence-based practice. You want to formulate a foreground question to help you start exploring what's going on. You want to find best current evidence. You want to look at critically appraising the evidence that you have found. Is it truly useful? Is it truly something that is realistic to replicate in research? Some of those things that you want to look at. You want to look at the evidence summary. You want to decide whether the evidence is strong enough to influence your clinical practice. You want to integrate the evidence with the intangibles, things that we may not have necessarily control over, or things that may influence the situation. And then you want to continually update. This is not a one-time process, but you want to continually go through this process. So step 1, formulating a foreground question, is primarily where we plan to stay with this particular presentation. And one of the things you want to look at is the foreground-background distinction. When you're looking at background questions, you're looking more for general knowledge. And you tend to use the W type questions: who, what, where, when, how, and why. They're more frequent when our experience with the disorder is limited when using the background question, and its relative proportion of background questions decrease as clinical experiences increase. So once we're starting to gather the evidence, we're probably not going to use the background question format quite as often. You then want to look at foreground questions. And this is more of the focus of evidence-based practice, because we want to see what is currently occurring from a clinical perspective for our population. We want to ask a specific, answerable question about the best way to diagnose, prognose, or treat. And when we talk about PICO, there are 4 essential components that we're going to concentrate on. So let's look at formulating a foreground question using the PICO format. PICO is a mnemonic used to help you clarify your clinical question. It acts as a framework, asking you to think specifically about different aspects of what you want to investigate. As you build your PICO, you should make sure that you are clear and specific about what you are looking for. This helps you target the right evidence to use in practice. So the 4 components as listed on your slide: P represents the patient and or problem of interest. I is the intervention, or broadly defined to encompass clinical decisions about diagnosing, treating, prognosticating, etc. C is the comparison intervention, and O is the clinical outcome of interest. In some questions, a T is added to the PICO framework, so PICOT. And this is added as well to help find a specific level of evidence. In this case, T can represent time frame, type of study, or type of question. Why are PICO questions good questions to use for evidence-based practice? It helps focus scarce learning time on evidence directly related to patients' needs and our particular knowledge needs. So we get really focused in terms of what we're looking at. It forces the learner to choose their own agenda. Why am I looking at what I've chosen to look at? And declaring that within the construction of the evidence. It helps you to facilitate the literature search. We need some basic question to help establish, is our question researchable and is it going to be clinically relevant to the population that we're serving? So we need a starting point, a ground zero, if you will, to establish. And we want questions that are answerable, reinforcing the satisfaction of finding evidence that makes us better, more effective clinicians. So on this slide, it reiterates the 4 components of PICO, but the 2 things that I want to emphasize on this particular slide is looking at what type of question are you asking. You're going to use the PICO format no matter what type of question we are asking. And we talked earlier in the presentation about the different types of questions. For instance, diagnosis, prevention, therapy type questions. We can use the PICO framework to help establish those questions. We also want to look at the type of study you want to find. Remember on the previous slide, we also talked about different methodologies that can be used. So we want to identify what would be the best study design or methodology. So the next few slides, I wanted to take a look at sample PICO questions based on the different types of questions that we may have. For instance, this first slide, we were looking at intervention and therapy. We talked a little bit about that, but it's basically questions addressing the treatment of an illness or disability. So when you're setting this up in a PICO format, you might set your question up similar to what you see on the screen, the right-hand side of your screen. In blank, which is your P, your population, how does your intervention compared to whatever you're planning to compare that intervention to affect the outcome within a designated time frame? So a couple of sample questions to show you how you could use the PICO for intervention and therapy. So let's look at the intervention question. An African-American female adolescent with hepatitis B, which is your population, how does acetaminophen, your intervention, compared to ibuprofen, affect liver function? The outcome is looking at how it affects liver function. In your therapy sample question, in children with spastic cerebral palsy, your population, what is the effect of splinting and casting, your intervention, compared to constraint-induced therapy on two-handed skill development? Note we've used the different components of PICO in this. So let's look at the etiology question. Just to reiterate, etiology is questions addressing the causes or origins of disease, such as factors that produce or predispose towards a certain disease or disorder. So a sample way to write up your etiology question is are the population who have some type of intervention compared with those without at potential risk for or risk of something over time. So let's look at that and how as a sample question. So in the sample question, our 30 to 50-year-old women, our population, who have high blood pressure intervention compared with those without high blood pressure at increased risk for an acute myocardial infarction during the first year after hysterectomy. Our next type of question we're going to take a look at is diagnosis. Diagnosis, the questions are addressing the act or process of identifying or determining the nature and cause of a disease or injury through evaluation. So to set up your question, you can state something similar to in your for your blank your population, R is blank your intervention compared with something else, more accurate in diagnosing whatever potential outcome you're looking at. So a sample question under the category of diagnosis, in middle-aged males with suspected myocardial infarction, are serial 12-lead EKGs compared to one initial 12-lead EKG more accurate in diagnosing an acute myocardial infarction. When looking at prognosis or prediction questions, remember these are questions addressing the prediction of a course of a disease. So again, you can set up your question similar to what you see on the right side of your screen. In blank, your population, how does the intervention compared to something else influence whatever potential outcome over time? Your sample question for prognosis or prediction. In patients who have experienced an acute myocardial infarction, again, that's your population, how does being a smoker, your intervention, compared to a non-smoker, influence death and infarction rates, the outcome, during the first 5 years after the myocardial infarction over a time frame? Now, the previous set of questions have focused on a quantitative framework, more of an idea with that. But some of the information we want to gather may have more of a qualitative idea. So one of the other categories is meaning, and this is looking at questions addressing how one experiences a phenomenon. Now, it's not necessarily limited to qualitative. You may want to explore a phenomenon from a quantitative standpoint, but this is just suggesting that you can extend this idea to a qualitative. So your sample question, how do blank, your population, with some type of intervention, perceive, in terms of that's their outcome, during a certain time frame? So your sample question under meetings, how do young males with a diagnosis of below-the-waist paralysis perceive their interactions with their romantic significant others during the first year after the diagnosis? So you can see how the different components, once again, of PICO have fallen into place based on the types of questions. So one of the things that I hope you recognize and that this screen is showing you is that although we have PICO questions, we can basically rephrase the question to have the question fall under different categories. So for instance, this is a PICO example of one scenario and two different populations, but you can have many possible question types as a result of this. So an intervention question here, and Curtis gave this example 2014. An intervention question is your P, adults over 65 years in residential care. I, the intervention, receiving medications from RCA. C, receiving medications from the RN, and O, rates of medication rates. You can modify what you're trying to look at in terms of that, so and reestablish it as a different type of question. So they've established it as a meaning question, for instance, here. So your P are the RCAs working in residential care. Your I is delivering medications to patients. And your O is workload and level of responsibility. So you see how the focus of who your population is that you're planning to focus on, the interventions, etc. You change a component of that, you've created a different scenario with your research question. So in summary, PICO is a way to organize evidence-based material. PICO questions focus on clinical issues. You want to enter the elements of the PICO question in a standard order. So first you're going to have your P, then your I, then C, then O, then T if applicable. You can identify different question types by changing one question component, and you can identify the elements right inside your question. For example, in older adults, your population, how does hydromorphone, intervention, compared with acetaminophen, your comparison, affects pain relief, which is your outcome, within the first hour after administration. All the components of PICO are listed there on your question, and you can physically put those components on your paper to help you identify those components. Thank you very much for taking the time to listen to this presentation about PICO questions and determining how to create a PICO question. This concludes the presentation.